Okay. Yes. So I just got it now,
Is
and
it
let's
running
see.
now?
Just uh, I got it now. Okay. Now it should be coming up. Okay. I think you're on live now. I'll just
Yeah.
check with my Shri. Can you check if it is? Yeah, you can see the screen. Yes, we are online shift.
Yeah. You watching?
Okay.
Yeah. He's
So
sharing a screen now. So I need to stop sharing my screen.
yeah.
But
So I will share my screen and I'll go through the thing and we'll see if it goes well. Okay. Yes, I think it is working now, Shiv.
it is
What I can
working now.
see,
I got
yeah,
it. Got it. What the thing is? Yeah. Why we couldn't do it, and
yeah,
then now.
I can see that it is saying live on
Yeah.
custom live streaming service. It doesn't say
Yes.
YouTube, unlike previously it was
Yeah.
saying
Yeah. You
YouTube.
need to go to a custom live. Yeah.
Yeah. So now, can you enable share, screen share?
Yeah. 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 Sorry. Yeah. That's it.
Okay. So I'm going to share my screen about Medusys, and I'm going to go full screen. So is
Yeah.
this visible?
It is visible. Yeah.
Yeah. Okay. Thank you very much, Shiv, for providing Medusys with this opportunity to help all anesthetists across the world, especially in resource poor and time poor situations. Um, our aim is to empower each anesthetist, enable each patient to have better outcomes. Um, just a little bit of introduction about Medusys. We are a M Health and data science technology company based out in India and Australia. We have a technical team based in Bangalore and Mysore, and over a period of last 3 4 years, we have developed different digital platforms to help anesthetists to improve outcomes in anesthesia. Now, some of these products have already been endorsed by some organizations, and I'm proud to say that Global Anesthesia Society, headed by Dr. Shiv Kumar Singh, has enabled to enabled us to take a giant leap in making this platform bigger and much better. At the end of the day, our vision has always remained that to enable universal e-healthcare, and it is through the use of innovative use of technologies that are at present with us. And our core value always will remain in these four things: patient centric care, accessible healthcare, that is basically providing that last mile connectivity so that every healthcare service across all strata, be it in a remote rural location or in the high tier city, every healthcare worker and patient should have access to e-healthcare. Data privacy is considered with the highest possible manner, with all privacy principles embedded in the architecture, and we'll provide quality care through patient engagement and in evidence-based care. Initially founded by myself and my very close friend from childhood, Mr. Prashant Magdi. He's got extensive experience working in US and is an enthusiastic entrepreneur based in Bangalore. We got some technical team members who are got wide range of exposure in digital technology and have got decades of experience across them. And of course, Shiv Kumar Singh is the pillar behind the gas and this new project that we are developing. In order to understand what we are developing and why we are developing, it is important to know what is the patient journey and how process mapping helps in identifying burdens or help in identifying barriers in providing better quality care to our patients. Patient journey seems to be very straightforward. A patient gets identified with a problem, say, for example, a surgical problem. So he consults a surgeon or maybe a primary physician, then goes to a surgeon. Through this process, there are multiple health checks that the patient undergoes, then goes through to the hospital based system or a healthcare based system where he or she may need a surgery. Then there is a follow up of care, and there are some changes in behavior, and future improvement in healthcare happens through continued engagement with healthcare system. Although it seems very straightforward, there are a lot of barriers in providing good experience to a patient. Paperwork, there are multiple layers of paperwork that at every step in the healthcare, there are a lot of paperwork to be filled up, and there is so much of redundancy. It becomes an onerous task. Often the forms go missing, the lab data work goes missing, and waiting times are extended. Patients feel that their overall healthcare experience is quite challenging. There are a lot of unknowns, and there is fear. First of all, they are undergoing a surgery, and there are a lot of complex treatments with unknown outcomes. There is also multiple interactions with different healthcare specialists, allied health, and the nursing team, and there could be conflicting and inconsistent interactions. Of course, the medical information that's been provided throughout their care can be quite stressful to them. And they might have very poor recollection of this information, which actually can lead to, or there is a potential to lead to poorer outcomes because they may be unable to follow the instructions or follow the medications that are necessary to be taken. And in very busy practice, and often the specialists have time limitation in order to explain every aspect of care to the patient, and thereby there is a chance for miscommunication or misjudgment between doctor patient relationship. And also, if you look at the process mapping of the patient's experience, you can see it is much more complex than the simple patient journey as we see it. There are different stakeholders, there are different systems, and there is multiple layers of data which interact and cross interact, which can lead to multiple layers of errors, missing data, and poorer outcomes. So our approach has been trying to unify the approach and keep patient in the center. And when you put patient in the center and in charge of their care, it is very well known fact that there are better outcomes. And all this complex interaction can be simplified if you look at patient in the center of the care. There is always continuity of care that is well established. We have a better informed patient, and there is better communication with all the different types of healthcare providers. There is better workflow, there is better resource utilization, and patients' anxiety and fear is reduced if there is better communication and better information. Our Medusys Gas project is born out of this idea of patient journey and improving outcomes. So the pilot project began few years ago, and different layers of platform have been developed. To begin with, if you understand a patient journey in a perioperative surgical field and in anesthesia and pain management, we often see the patient in the preoperative phase. Then the patient undergoes the surgery, which is the intraoperative phase, and then there is a postoperative phase of recovery and rehabilitation. There are different stakeholders and different layers of data flow, and we need to keep these in mind with patient at the center of this care, and then develop a model towards improved services to the patient. So we developed our first pilot project called Medusys Gas App. There are three inbuilt systems within the Medusys Gas App. One is the patient management system, second is the clinical databases, and third is the MELS CME. MELS stands for Medusys Education Learning System or Continued Medical Education. Each of these modules have different kinds of in the perioperative environment. If you look at the patient management system and the patient flow, you will understand how it is useful. Now, some of these modules are still in the stages of development. Some of these have already been built up. Patient has, with a history of all the medical problems, and multiple lab data, they can have their own personal health record or health questionnaire, which can be seamlessly shared across multiple healthcare providers without any data loss and can be kept continually updated. Then there is a system or a module for telehealth where the doctor or the healthcare provider interaction with the patient is improved and there is continuity in care. We can obtain e-consent and also provide information about the patient and have a legally valid consent from the patient. EPCOM or EPRIM, we call it as, which is patient-centered outcome measures or patient-related experience measure. When we keep patient as a center of all this management, healthcare management, we need to understand or we need to know what were the patient expectations, what are the patient expectations met, how we can improve. That is where the EPCOM comes in. E-care is essentially a patient information portal where we as healthcare providers can provide digital leaflets, digital information about their medical or surgical condition or their rehabilitation information, information on anesthesia, and information on pain management. So a patient who is armed with knowledge pre-operatively and post-operatively, or a patient who is better informed will more likely to have better outcome. Clinical databases are focused on healthcare providers. This is where we generate real world data. And this real world data, when powered by AI, can give valuable insight to our practice and improve the quality of care we can provide. It is all about quality and safety, how we can continually improve the quality of care we have provided. We first developed the peripheral nerve block database, and now with increasing demand, the central neuraxial blocks have been developed. We are in the process of developing the labor analgesia and obstetrics along with logbook. And of course, doctors are not only armed with this up-to-date quality healthcare from their own real-world data, they can also be armed with medical knowledge and continually improve their medical knowledge. The Facebook group, the anesthetist, with more than 30,000 specialist anesthetists from across the world with more than 100 countries, have been providing valuable information, education. There have been case-based discussions going on. Now, all this information needs to be stratified, needs to be collated in a proper way, and also there needs to be an ongoing engagement and update in the knowledge. So this is where this MELS CME will provide an opportunity for every specialist to improve their knowledge and skill base. The Medusys Gas app will be available as an app form, or it can be accessed through the web approach also through your desktop and laptop web browsers. This is the table showing which are all the parts of the project that have been completed and who are the different stakeholders who can be involved in improving the quality of care. We've already done the EPHQ, that is the e-personal health questionnaire. E-consent is ready to go, and e-PCOM or e-PREM is ready to go. PNB is done and ready to go. The CNB and all these projects are being developed in a stepwise manner. And in the upcoming TACON 2022 in November, to be held at Hyderabad, this will be officially released, will be available to all the gas members for free in the first year. There has been a huge interest in the anesthetist Facebook group, where more than 400 people or anesthetists have contributed as a crowdfunding to the Global Anesthesia Society to develop and enhance this project. Since the pandemic, there has been increasing interest in using central neuraxial blocks, segmental spinal or thoracic spinal, in providing surgical anesthesia and better outcomes to the patient for upper abdominal and thoracic surgeries. So far, there has been very limited evidence, and probably this will be the first kind of international database on real world data coming out on CNB and PNB. So keep a lookout on this project, which will be released very soon. So our journey has been like this. We started off with the RAD app, which is Regional Anesthesia Database, which was focused on peripheral nerve blocks. Multiple articles have been published and are presented at multiple places. And few other anesthetists have also published their own data on peripheral nerve blocks. And by November 2022, we are hopefully going to release most of the modules in the Medusys Gas project. As I said earlier, the security, privacy, and compliance to the regulation is our utmost priority and is inbuilt in the architecture of this whole digital platform. If you need any questions, don't hesitate to contact me personally and visit our website. Thank you very much. Thank you very much, Chief.
Yeah. I think that was a nice introduction, Guru. And we will start getting ready for the our symposium, crisis symposium, in a few minutes' time. And I'll
Okay.
see you then.
See you then. Thank you, Chief.
See you